it's ECG, whether it's fever. Fever is also quantified with a number. So small thing like that, a small illness like that is quantified. Now, I'm wondering, how in this sector of healthcare, physiotherapy and rehabilitation, what kind of feedback you get, and is evidence-based treatment being followed? I have a lot of questions, but let us go on a step-by-step way. So my first question is evidence-based treatment needed in this area of healthcare? If yes, why and how? Please, sir, please enlighten us.
Yes. Hi. First, I would like to thank everyone and all the participants and Suresh for conducting this webinar. So before I answer to this question, I would like to tell you something, that today I am going to talk both as a clinician and as an entrepreneur. So my answers would be reflecting the clinical side and the entrepreneurial side.
Please.
So coming to the question, is the evidence-based treatment needed? If yes, why? If yes, why? So before that, let me give you a brief insight on what is this evidence-based treatment. So basically, evidence-based practice, we call, only practice relates to treatment. This has been very controversial in the beginning years. But since 1992, when they introduced evidence-based medicine as a subject, this has gained some weight.
Okay.
And coming to this evidence, it's very complex topic to start with, because the grading and all, because usually they grade. And the topmost in the grading, what they call in the pyramid, top mode pyramid, we call systemic reviews and meta-analysis and RCTs, randomized controlled trials.
Okay.
And the editorials and experts' opinion and other case report studies, they are of the lower side. Lower in the sense, risk biased, it's higher. And quality of evidence, it's lower. The higher you go to that pyramid, it's higher the quality and higher the quality of evidence and lower the risk.
Okay.
So now you're coming to your question, why is it needed? The reason why is it needed, you need to understand, in order to gain proper clinical expertise, you need evidence-based practice. So I will briefly tell you how it helps. It helps physios to stay current on standardized evidence-based protocol. So I'll explain you this. This is an expulsion of scientific knowledge being published, making it difficult for clinicians to stay current. So there has been a study that has been conducted which said you need to read at least 17 articles a day to stay current on the subject. So that's about 6,200 articles, which is an impossible task for any clinician to do. So to have better understanding, what we need to do is, you need to start practicing more on evidence-based practice. Okay, then coming to the second point, it improves transparency, accountability, and value.
Very nice.
Both the employers, patients, all are driven the need for healthcare industry to show transparency, accountability, and value. Practicing evidence-based healthcare can help the industry achieve these goals and improve quality of care. And the third most important is the outcomes. The most important reason for the interest in evidence-based medicine is that it works. It really works. There is a lot of data that shows if health systems that use the best clinical evidence and expertise and ensure treatments are consistent with patient values, they realize that better outcomes in every way.
Okay.
It helps the quicker recovery rate as well.
Great. Awesome.
So this is why you need it.
Great. So I think you have given a very beautiful answer, that it increases transparency, accountability, and value and ethics of the patients. I think that's a big answer kept in a very small way. I have been to the Indian Association of Physiotherapists conference this year, and very happy to see that majority of the focus of the entire conference was based on emphasizing evidence-based physiotherapy. So I think that is what is coming up, and our country is gearing up for that. And the answer that you shared about transparency, accountability, and value of patients is really worth mentioning once again. Sir, you have practiced in India for a long duration now.
Yes, 6 years.
Almost a decade. And you have also practiced in one of the advanced countries for physiotherapy, which is Australia.
Yes.
So just throw some light, because there are a lot of audience here who would love to know what is happening in the adjacent countries. in this area of healthcare. So can you please throw some light on how the practice is happening in the recent years in an advanced country like Australia? Please, sir.
Okay. So coming to this question, how this evidence-based treatment has been implemented in Australia and how are they coping up with the practice?
Okay.
So coming to this, I need to tell you something that in Australia, physiotherapy is there. I mean, they have the university like some 80, 90 years before 80 or 90 years.
Mm-hmm.
In India, this profession is very new and it's very young and growing profession. It has come only like 30, 35 years back to India.
Okay.
I mean, in a proper structured way, I mean.
Awesome.
So on that case, they are way ahead in regards to research and other treatment studies. But we shouldn't undermine our potential. So
Yes.
before I talk about the potential in India, I'll tell you what is the present scenario in India. So frankly speaking, 90% of physiotherapists doesn't follow evidence-based treatment in India because of two reasons. One, emphasis on evidence-based treatment is significantly low at educational and clinical level when compared to other countries like Australia.
Okay.
And second reason is India doesn't have an institutional autonomous body to regulate, monitor, and encourage neither research nor practice evidence-based treatment.
Okay.
However, some institutions follow evidence-based treatment, but it's lack uniformity across the country. So what is the solution for this? The big solution for this is we need to self-regulate ourselves.
Okay.
And coming to Australia, how they follow, they use various technologies when leveraging when compared to this. They leverage technology or evidence-based treatment at two levels. One is the software level, where I categorize. This is my categorization. One is the software level, and the second is the hardware level. Software level, most of the documentation, in the sense assessment, diagnosis, treatment, all this documentation is done in a streamlined way, in a structured way.
Okay.
And every day, based on their inputs, they update that assessment sheet and all. So and the collection of data across the country, it's the same. It's not that one part of the city you collect something and the other part of the state you collect something. So it will be very uniform, structured way. And second, the hardware part, where they use EMG, electromyograph, and they use gait analysis, not the high-tech gait analysis. I'm talking of basic common gait analysis, which is of a lesser cost. And second, they emphasize more on posture analysis. And for the treatment aspect, they conduct these video games where that would be helpful in treatment of the pediatric and stroke cases. And the best thing about integrating all these technologies in treatment, what they do is they document everything and they clearly integrate evidence-based practice into it.
Great. So yes, so it's quite evident that one of the reasons what you mentioned is because Australia is quite old in this sector, and they have already developed good practices of physiotherapy and rehabilitation. And I also see a positive sign from your end that things are coming up here. But as you said, that most of the people in India are still on the verge of entering into evidence-based physiotherapy.
Yes.
This brings to my next question. So you mentioned 2 points. One is at the education level, there is already, there's no emphasis on this thing. And also there are no institutions. But the second one, I think the Indian Association of Physiotherapy, the group of top physiotherapists in the country, are already trying to formulate few aspects. Am I right, sir? They're trying to formulate few aspects to some standardization at least.
Yes.
Okay, so I just it's a follow-up of the earlier question. Can we do anything to make some improvements at the education level? Because see, these are the students who will be graduating and who will be the practicing physiotherapists in future in the country. So I just want to know from you, are there any measures towards, in that direction where some evidence-based treatment mechanisms are also being introduced to college students? Is there anything happening, or just want a quick answer on that regard?
Situation has been changed quite drastically, sir. As you know, when I was studying, it was not as good as now. And when my seniors or the people who studied way years ahead of me, they didn't study the way we studied.
Okay.
So at one aspect, it's good thing that things are improving, and at one level, things are not moving because, as I said, it lacks an institutional autonomous. When I said it's the institutional autonomous, it's in the form of government body, like how equivalent of MCI. We don't have physical
Yes.
therapy council. But I don't want to blame everything on how to say on council. I'm not saying that evidence-based practice is not implemented because council is not there. Still, despite whether council or not, when we stay away from that discussion, still this can be implemented. So what I feel is clinical instructors are in position to influence students or freshers during their clinical education. And thus, they can play important potential role models in evidence-based treatment. Actions from academic and clinical settings are needed to improve competence in evidence-based practice among clinical instructors. And future research is needed to investigate the effect of such efforts on students or freshers' behavior.
Sure, sir. So what I understand is you say the seniors have to play a role now.
Yes, they have to play the role. Because when government is not acting, it's the seniors who need to take up the task.
Very nice. Yeah. That's a very good takeaway. I see. Okay, awesome. Great. So one important aspect is, though you have told about the importance of evidence-based treatment, can you throw some light on how the treatment differs? The quality of treatment differs when you do evidence-based treatment as compared to when you do not do evidence-based treatment. So maybe, for example, the duration or the quality of treatment or the way the person recovers. So can you throw some light on these metrics which actually quantify recovery, and how does this kind of methodology of treatment help you and the other kind? So in the initial question, please, I want you to focus on and enlighten the audience on the clinical aspect, because I have a follow-up question. So
yes,
please.
yes. So basically what your question is, when we follow evidence-based treatment and we don't follow the evidence-based treatment, how are the results and how are the outcomes of the patient?
Yeah, the clinical.
From the clinical point of view.
Yes.
So I'll tell you, I'll divide this into two parts. One is the evidence-based treatment, and the second we call it practice-based evidence. Evidence-based treatment and practice-based evidence. Practice-based evidence is nothing but it's the anecdotal evidence. We call it the anecdotal evidence. The anecdotal evidence is nothing but it's the casual observation or indication rather than rigorous scientific analysis. It's the evidence that comes from an individual experience. In India, most of the physios, it's not that they don't follow the evidence, they follow the anecdotal evidence. Because out of their experience, what they get, they do it. Basically, books, the textbooks, what we read at the colleges and all, they provide a strong foundation to us. But they don't cover the actual clinical part there. This only gives us the foundation. The actual practical part is more covered with the hands-on and the evidence-based treatment by reading the articles and all. So most of the physios in India, majority of us, including me, I shouldn't keep me, rest of the crowd, we used to practice anecdotal, or we call it practice-based evidence. But the problem with this practice-based evidence is the number of clinicians and the the clinicians, when they practice, they get certain results. And on a long term, this do more damage to us rather than good. Because the amount of cases in India, what we see, it's huge. But the problem is majority of the clinicians doesn't collect the data. Or if they collect, they don't collect a valid or acceptable data. If we collect an acceptable, valid data, then that data can be a colossal. It can be colossal data that can be used huge for the research.
Yes.
For all these years. So I'll give you one of my experience in treating this on this part. So we have a patient who is a 45-year-old who is suffering from the tennis elbow. So my initial years as a clinical practitioner, first 1 year after returning from Australia, I couldn't implement evidence-based practice because clients demand something and evidence-based practice shows something. So there is conflict of interest sometimes. So you need to carefully balance how to do and all. You need to, master it. No one teaches you anywhere. You need to get it.
Okay.
So we have this 45-year-old female patient who visited 4 orthopedics and 7 physios in duration of 14 months. And we solved this issue in 19 sessions in 2 months duration.
Okay.
So how did we achieve it? We just achieved it with evidence-based treatment. So what we have done is we have studied 87 case studies.
Okay.
And all of them were quote unquote systemic reviews. Systemic reviews, as I told you in the earlier, it has the highest in the pyramid.
Okay.
So we covered around 3,622 patients data we have studied. We have narrowed down.
For that particular ailment, you say? For that particular
Yes. We maintain that research data.
Okay.
So then we narrowed down to 15 case studies. Out of 87, we segregated them to 15 case studies.
Okay.
Then we searched our expertise. I mean, earlier what our protocol we followed. Then we compared both. Then we developed 2 protocols based on that.
Okay, awesome.
So based on that, then we could give very good evidence-based practice. And as I said, when you take systemic reviews into consideration, it's hard for people. It's very, very difficult to find a false systemic study. So that's how we could cope up. So that's the difference.
Okay, awesome. So the thing is, what I understand is for the case study that you have described, sir, is more about something that has happened and some research is published, and then you converged to a particular methodology and design something which helped. But the thing is, how does this? So this definitely might have taken some time for you to study and understand those papers, the systemic reviews that you did, which might not be also accessible and available to a lot of people. In that case, my question was, you have very clearly explained a very good approach, which is published and it works. But my question was, when you practice evidence-based physiotherapy and when you don't practice evidence-based physiotherapy, what is the outcome, the quality, what is the impact on the quality of outcome of the treatment that happens on the patient?
I think I'll elaborate that. But before I proceed, I'll give you one example. In my case study, I said the patient has seen 4 orthopedics and 7 physios in 14 months.
Okay.
That's what it happens when you don't practice evidence-based practice.
Okay. So that basically the impact is, I'm sorry, I did not get that part. So that is basically it has extended the overall treatment process.
Yes. Which we could recover her in 19 sessions in 2 months.
In 2 months. Okay.
So basically, patient has to spend her energy,
time, resources,
everything, and suffering.
Yeah, that's the most important aspect, which is not quantified.
And second thing, what you mentioned was it won't be easy for all to practice this. So I'll give all the audience who are there, if most of them were physios.
We will have
5 tips. One is formulate an answerable question. When you want to practice evidence-based treatment, formulate an answerable question. One of the fundamental skills required for evidence-based practice is asking of well-built clinical questions. By formulating an answerable questions, you can focus your efforts specifically on what matters. These questions are usually triggered by patient encounters, which generate questions about diagnosis, therapy, prognosis, and etiology. And second, once you formulate the questions, then find the best available evidence. Okay, in these steps, it involves identifying search terms. How should you search? Then how can you select? Most likely you have this open resources like PubMed and all. Then you need to formulate an effective search strategy using a combinations and limitation for the results. So first is answerable questions. Second is find the best available evidence by framing what are your search terms. Second is appraise the evidence. It is important to be skilled in critical appraisal so that you can further filter out studies that may seem interesting but weak. Use a simple critical appraisal method that will answer these questions. So the questions are like this. What questions did the study address? Were the methods valid? Third, what are the results? How do results apply to your practice? And implementation of the evidence. After that, with individual clinical decisions can be made by combining the best available evidence with your clinical expertise, because already we'll be practicing, right? So you will compare this evidence with your clinical practice along with patient values.
Awesome.
So
Okay.
you need very good research supporting document. You need a good clinical expertise that need to be combined with the patient values. Let's say you are treating someone, even if patient doesn't agree to such treatments, so you can't do that. So patient values are equally important. These clinical decisions should be implemented in your practice, which can be justified as evidence based, and then apply your evidence. Then evaluate the outcome. The final step in this process is to evaluate the effectiveness and efficacy of your decision in direct relation to your patient. Then ask yourself the following questions. Was the application of this new information effective? Did it make any sense? Should this new information continue to be applied in practice? How could any of the 5 processes involved in clinical decision making process be improved by the next time a question asked?
Awesome.
So in brief, I'll tell you simple. Ask the question, acquire the research evidence, then apprise. I mean, the apprise in the sense, aggregate the evidence, then apply the evidence, then evaluate the outcome.
Very nice.
With these simple 5 steps, you can make difference. Now, coming to the conventional method, anecdotal evidence, where you treat someone, let's say you might have massaged, or you might have given IFT, ultrasound, you might have given a placebo to the patient. So that particular patient might have said, yes, I am fine. But this same placebo might not work with another patient.
Yeah, very true.
Then that will waste the time of the patient.
Understood. So the best way is to formulate these questions even before you start the treatment, have the work done, and then start getting some feedback from the patient on every step. And if your theoretical study that you did is actually matching one-on-one with, or correlating rather, with the outcomes that you're seeing with this step-by-step method.
Yes.
And I think that gives, and finally the last step is evaluate efficiency or the efficacy of your treatment. I think this also helps you make your treatment better. Every time you get a new patient, you use your previous expertise.
Yes.
Great. So what I see is the step-by-step approach or the formula that you gave. I am sure it will definitely add some value to our audience. And documenting is, I think, one important thing, which was also an integral part of this year's physiotherapy conference. So documenting, one more thing which you yourself pointed out, is quite subjective. I think some things have to be improved there also. And I think that's also improving on a day-to-day basis with practice. A follow-up of this question, based on evidence-based or the outcome-based treatment that you do, how do you see this disciplined and a well strategized way of treatment impacts the business of a physiotherapist? Can you please tell the pros and cons? The earlier question related to the clinical aspects. Can you please throw some light on the business aspects, or any case study where you saw when you did this, you had greater revenues, greater trust from the people? Maybe you can share your experience, sir, please.
So for this question, I need to answer more like an entrepreneur than a clinician. So I'll try to mix match both, and I'll try my best in producing this.
Sure.
So basically, when you use evidence-based practice, in particular technology can be used both as assessment and diagnosis tool. I once again want to remind you, COVID has proven how vulnerable physios are. The main reason is we haven't changed much in adapting technology, and physio's salary and income is low. Do you know the reasons? Anyone? Do you know the reasons why physio's income and salary is low?
Yeah,
can you please answer?
Yeah,
I know. First, as you told, it is there's no proper institutionalization of the course or the curriculum, as we don't have a proper council or guidelines or anything which really prescribes the salary or outcomes or whatever it is, which is very important. And then that is a very standard thing where we get exploited at the corporate sector, which I really feel. Now you see softwares, they have a very strong firm. We don't have it. So that is the main reason which I feel, practicing here or giving a commitment to a corporate place, which is like more difficult. I freelance, I make good money rather than giving commitment to a hospital and paid very less. So yeah, you're paid less. End of the day, we work for money. We need money. So yeah. So that
Can
is
I know who is that? I mean, can you?
This is Dr. Narla from Hyderabad.
Okay. So you are a
Great.
practitioner.
Great insight.
Yeah, a freelancer. A freelancer.
Okay. So I'll just explain what are the reasons from my perspective, because I have been running an institute from a couple of years. So yes, to a certain extent, I agree that we need counsel, but counsel has nothing to do with the income. I'll tell you what are the reasons. There are two main reasons as per my perception. One is we earn less per hour because we are underproductive by seeing 2 or max 3 clients per hour. In this space of time, imagine how many patients a physician can see. And second, we have single source revenue model. We earn only seeing patients. We don't get referral bonus from pharma or diagnostics. We don't get that. So the basic reason is we are less productive per hour, and single source revenue model is the key reason for the low pay. Instead, we can use technology and have our own diagnostics that can't be provided by the conventional diagnostic centers. I think this is a high time to adapt technology. If not now, we can never adapt technology. Documented data is very, very important, because for any future innovations, this data is very key.
Yes.
And I'll just talk briefly about the pros and cons, as you said, advantages and disadvantages. I'll call it advantages and challenges. I'll not call it disadvantages. It's the advantage and challenges. So one is using this technology and all, or the evidence-based treatments, it's very effective and gives quick results. But most of the physios, there is a perception that if it gives quick results, let's say I want my patient to come for 1 month package or 15-day or 2-week package, whatever, this package things continues everywhere. So there is a perception of this. So what you can do is, so let's say, as I said, in tennis elbow patient, where she wasted 14 months of her time and couple of visiting doctors and physios, she spent money. What you could do is you can increase your cost per hour because you are saving time to the patient.
Yeah. I think that's a very good perspective that you have given.
Yes. And next, it improves the productivity. We can see the more number of patients. So we should not limit ourselves that we should see only 2 patients in clinic or 1 home visit per 1 hour or 3 patients at max. That shouldn't be the case. We should use the technology and leverage it and see more number of patients. Then it also helps to monetize from the diagnostic approach. Diagnostic in the sense, in our institute, we have the EMGs. Use that as the diagnostics tool. It's an additional income source rather than typically depending on the conventional X-rays or something. I'm not saying X-rays are wrong, but yes, you can do it when needed. But we also need like parallel income sources, like how physicians earn. And second, it saves client time, right? A lot of travel time. And it reduces their clinic wait time.
Very nice.
And the costs are less, because if you include his travel time, everything, his petrol, traveling, everything, that's huge. And you can simply store this. And most of the physios, the biggest problem is they're using technology just to store the data. They're something more like medical aggregators like Practo. I shouldn't name, I'm sorry. They're using these medical aggregators. They're using that to store the data for the appointment schedulation. That is not using of technology. When you store the data, as you know, data is next crude oil for this world. And it doesn't build your reputation or your clientele in any way. So I'll just talk about what are the challenges. One challenge is lack of understanding how to use things. And second, resistance to change. Third, it's due to lack of training for both the staff and the owners who are running the business. And second, they doubt how would the patient receive this. They doubt on patient reception of this using technology, because they got used to that old school techniques of using ultrasound or IFT for 1 hour session this much, half an hour this much, 2 modalities this much, 3 models. So like that. So think present model is simply, and they think that present system is working quite fine. But practically in crisis like COVID, most of the physio.
We need to leverage.
We're struggling a lot. So I feel these are this answers your question.
So I think your answer is on the positive side, where though you have to put it in a very objective way, but I'm sorry, Narla, can you please mute your thing, please?
Yes.
Yeah, thank you. Thanks
Can others ask any questions?
Can we have the Q&A at the end, please, if you don't mind?
Sorry?
Yeah. We will have the Q&A session at the end of this.
Sure.
Please keep your question. And you can please put your question in the chat box so that, we don't miss out your question, please. Thanks a lot.
Okay.
Yes. Yes, Dr. Yeswanth, so what I see from your answers, one thing is very, very evident, that standardization of things, standardization of practices, if you see from the holistic front and if you get into the minuteness, you are actually telling that it has a very positive impact on your business, positive impact on your revenues, though it sounds that the treatment time was less, but I think you have actually created a very trustworthy customer. And also, as you rightly said, the word of mouth might also spread from that customer to the other customer, where you will also get, though your wait time in your clinic reduces, but you are actually flooded with more number of people who actually want your services. So that's a very beautiful insight that you have brought. I think one thing which can be dealt in detail in future sometime, maybe the exact way of how do we quantify these different aspects, how do you document, and then prove to the fellow physiotherapists to also motivate them to practice evidence-based physiotherapy, which ensures quality recovery in a shorter duration of time, but at the same time, from the experience that you have shared, is actually giving you greater revenues in the days to come. It's a very big topic, I know, but I think your case study and your experience has actually proven this, that revenues will increase with standardized methods of physiotherapy. Thanks a lot on enlightening the audience, in this regard. And I think you have shared a lot of current practices. And one thing which I want to tell the audience, I have been to, SIRS physiotherapy clinic and institute multiple times, and there's good equipment. And the best part of Dr. Yeswanth's clinic is he is practicing evidence-based physiotherapy. I have seen it live. He has his own set of EMG machines, with which he actually measures the quality of muscle, the way it does. I'm not a qualified person to speak about physiotherapy, but when as an outsider I see things, I see that I see happy customers walking out of his clinic. So evidence-based is actually being followed by Dr. Yeswanth. Just to the audience, I think few members in the audience were eager to ask a few questions. I request all to please type your questions in the chat box. And at the end, we will also have a audio call if it is required, if your chat, the question that is written on the chat is not sufficient. Please. Miss, yeah. Sir, so, yeah, hello.
Yeah.
Yes.
Yeah, I can hear you.
Yeah, so I think you have answered my last question, which was there in my mind, the acceptance towards innovative technologies and the resistance to change. Definitely, these two things are a challenging thing. Sir, one more thing. See, all the physiotherapists may not be financially sound to invest so much of money into the equipment. So what kind of equipment do you see, and what is the usual practice in the country? So that, evidence. One thing which I have come to know is you have given a very good step-by-step guideline to formulate the questions and get at an answer. But the answer that they will finally document should also be a standard one, is what I am. Please correct me if I'm wrong. Should also be a standard one. In that case, what kind of equipment do you see can be used in a very common way, which is affordable, and which can bring about standardization, revolutionary equipment that you see, which can also add to revenues? And how do you see these equipment also generating revenue for you? See, because when you are practicing an evidence-based physiotherapy practice, you need some equipment, standard scientific equipment, which will give the same answer to you in your clinic, or the same answer in somebody's like Dr. Narla's clinic or whatever, right? That is one thing. So what do you suggest in that way? Because your clinic has good equipment, maybe affordability is an issue. So what challenges do you see for the physiotherapists apart from keeping their problem of not wanting to change. That's a different story which you mentioned. Maybe the senior, they're not wanting to, or resistance to change, I will say. But the young physiotherapists who are the upcoming future, of the country, who can bring about a change and bring good practices. So from the equipment front, one is that. Second thing is, how do you, since you are practicing equipment, you are using equipment to create evidence-based physiotherapy, how do you see that also adds to revenues? Because finally, business is something which is very important, and also the clinical recovery. So from the business front, you said that evidence-based physiotherapy will bring you revenues. But can you throw some light, because you're using good amount of equipment in your institution? How do you bring the commercial value so that our audience will also come to know that they invest in something, and at the same time they will commercialize on that? Can you please throw some light on that, sir, please?
Yes. So basically, when I was listening to your question, I heard a lot of the times equipment. So I'll briefly clarify on that. So see, to start a physiotherapy clinic, you don't need huge investment.
Okay.
If I was a given chance, like I started my thing in 2014 December. If I was given chance, I would not now at this point, after these many years of experience, I will never invest that amount now. The reason for that is the need for equipment is going down day by day. You really don't, to practice evidence-based medicine or evidence-based treatment in physiotherapy, you really don't need huge investment or huge state of the art.
Okay.
I'm talking from my point of view, because I'm not into neuro cases.
Yes.
My clinic is equipped to deal only with the musculoskeletal or from the orthopedic or sports injury point of view.
Okay.
Because in cases like stroke and all, yes, that's a different part. I'm not talking more, because I'm focusing mainly on my area of practice.
Yes.
So you need to understand, first of all, as I said, majority of the clinics now are mainly focused on pain centric approach. So they focus, or they invest their money more on managing pain aspect. Be it ultrasound, be it IFT, be it TENS, be it laser, be it shockwave, be it hydrocollator, be it XYZ, whatever equipment. So majority of physiotherapy is pain centric. The reason for that is patient only visits us when they have pain. No matter whatever problems they undergo, they never come to us if they don't have pain. So majority of investments when setting up these new clinics, they were investing more on the pain centric approach. Okay. So what I feel is there are many other ways where you need not invest money into that, and still you can practice evidence-based practice.
Okay.
And where we lag more is there is lack of integration between the clinics, because one clinic next to me sees me as a rival, and the one next to him sees him as a rival. That shouldn't be the case. We should learn more from the doctors, how two doctors work very coordinatedly in referring patients from one another. We should function more in that aspect, and we should share our, not the patient data, at least the evidence-based approaches. I can say, see, I have found this thing, this research helpful to me. What are you following? Or they can form groups, like 3 or 4 clinicians who are practicing. They can form groups, and then like monthly ones at least.
Yes.
At least the rarest of the rare cases.
Do you have such forums and all available? Is it at a state level, or do you have a national level forums where you can practice, or do you think something?
Not as of I know, sir. Frankly speaking. But I practice that. I have very good friends with whom I discuss.
I think one output of this beautiful webinar and can be, if the participants are interested, we can have a group where we can start sharing, because that's a good news and good change that can be brought in the country, in this area of healthcare.
See, just because if I share my evidence-based practice with regarding one case, that will not steal my business. You will not loot my business.
No, definitely.
There is no point in sharing the technical insights. That will only improve the quality of care overall. And the prices can be increased. You will know how the other person is charging. So you can increase the prices, or you can keep a standardized pricing.
And as you rightly mentioned, if you follow the same standard, if your clinic is following the same standard as your neighboring clinic, quality of treatment that you give is definitely, is good. Is
Yes,
good.
yes,
And
yes,
as you mentioned, you can actually increase your fee. There's no problem because
yes,
customer knows that you will give treatment only for 1 hour, but obviously you're charging because they know they'll get treated once they come to
yes.
you. All this is happening only because of evidence-based treatment.
Yes. So basically, some cases takes a lot of time, no matter how better protocols you follow. Some recover very quickly. So my typical strategy is if I can solve that case within short time, I
Yes.
charge more. If I can't treat it in short time, I charge less.
Charge less. Yeah. And if you charge more, that's good. That person is away,
Yes.
from your clinic very soon, and you're better.
So using this evidence-based practice, you can reduce costs. Most of them doesn't believe because it's a double-edged sword.
Yes. Very
Because
nice.
why I said double-edged sword is because you can increase the cost drastically in the name of evidence-based practice. You can push them to X-rays, you can push them to that, this, all goniometers, all this. So before you do that, write out the framework how you are going to assess for each case.
Obviously, as
Or
you
if you have 10 cases, in the clinic, don't target 10 cases to start off with evidence-based practice. Take only 2 patients, if not 1 patient. Next month, increase that to 20% of your patients. Next time, increase that to 40% of your patients comes under evidence-based.
So maybe
Eventually, over 6 months or 7 months or 8 months of the time, you can include majority of them under this evidence-based. And the only myth is what they feel it increases cost. It only increases cost because when you invest, as I said, unnecessary radiology or diagnostic tests, or when you feel too defensive.
Yes.
And coming to the higher cost, see that as an investment part and change your business model. That's what I said earlier. COVID has proven our current business model is tested to its limits. Because all the present business models what various clinics are following, they have been tested to their limits.
Awesome.
And second good thing is you have reduced the chances of clinical errors. Because no matter how expert a clinician is, sometimes there is some minor chance of clinical errors. So you can reduce that. On other hand, the flip side, you have the risk of false studies. Because for every topic you select, there is an opposite evidence to show that this is wrong. These days, this is this trend. So always try to select the systemic reviews. As I said before, it's very, very difficult to do a false systemic study.
Because they're already published. They have case studies. They are published.
Yes. They have proper ethical committees and all. They get proper approvals before publishing.
So what you're doing is actually based on already,
Yes.
Sir, so I think this is great. We got a lot of inputs from you based on strategizing how to take things forward, strategizing the way of treatment, the importance of evidence to bring transparency, accountability, and all. And also the resistance, some challenges that you see in bringing evidence-based physiotherapy, in the current practice. And the most important aspect is taking systemic reviews and basing your treatment on past published good case studies, and also creating new material as and when you do, and share it with the other colleagues. Great. I think this is awesome. These were some of the important questions I had. And as you rightly mentioned, let me finish off my this thing with because the title itself is leveraging technology to make evidence-based physiotherapy. I think COVID has actually now mandated the use of technology to ensure that people are safe and still get connected, and still the physiotherapists have their business and patients get recovered. I think telephysiotherapy, just to conclude, telephysiotherapy might be the way ahead. So that is what I see from the technology front. Dr. Yeswanth?
Yes, sir.
Yes. So I see good number of questions today. All the audience, thanks a lot for joining. I am, these were some burning questions in my mind. So these are done. I would like to take up the questions one after the other. I see the chat, and if the questions are not clear in the chat, then we will take you over the call.
They can ask me, sir. No problem.
Yes. Let me quickly go through that. Yes. Good afternoon, all. I request the audience to put the questions on the chat box. There is a question from Dr. Jitendra Manjal. He's asking, sir, what is your view on colleges which offer the UG and PG degrees to students who do not attend the classes only due to lack of central counsel? Okay, so the students now lack the basic theoretical concepts, and so evidence-based practice is quite out of reach for the students.
Here I can answer in this. I think in our earlier question I have answered. Clinical instructors are in position to influence students or the freshers.
But the thing, what I understand from your short answer is, you say that these people will suffer, they go out, they suffer, and they have to learn the hard way. Am I right?
They have to learn the hard way. They will lose the pay. I mean, they won't get the
Dr. Jitendra, I think the answer is very quite and clear here. Get clarity. So would you like to share the evidence generated by the able? Okay. Dr. Kalpana is asking, sir, would you like to share the evidence generated by the able? I think Dr. Yeswanth has answered it as a case.
No, you can ask me, sir. I'll answer.
Okay. Dr. Kalpana, if you still have that question, can you please unmute yourself and ask Dr. Yeswanth?
Hello.
Yeah.
Hello. Yeah, Dr. Kalpana, please.
Good afternoon.
Good afternoon.
Yeah, it was a very enriching experience to hear from Dr. Yeswanth. What I wanted to understand is, sir is talking about generating the evidence at his own clinic. So is that evidence in a public portal now? Means obviously, because he has benefited out of his own evidence, he has informed his peer group also, but to make a mass movement, to make a mass difference, maybe if that particular evidence can be shared with the more physios who may be able to, take a start from there, maybe those who are initiating their clinics, things like that.
Awesome. Dr. Yash.
Yes, sir. I'll answer to Dr. Kalpana's question. Yes, we maintain all our data from past 6 years. Like if you name the patient or name their patient ID, I can pull their record and I can immediately get that thing. But the problem is, since we are in a commercial establishment, what we are doing is we are only sharing our data or experience only with the ones who are willing to collaborate with us. If any one of them has the interest of collaborating in the sense not any monetary collaboration, I'm talking of the technical collaboration. Technical collaboration where we can form a standardized protocols, we can share our experience. Let's say you had some XYZ, some frozen shoulder, some tennis elbow, or some whatever case, then we'll share our data with you to see how it worked and all.
I think that is one thing. That's where the groups and coming together helps a lot. Just to add, Dr. Kalpana, I'll also want to add my opinion here. I think if some good case studies can be published, because what Dr. Kalpana was actually requesting is how can greater audience have access to your experience and to the quality.
No, sir, I didn't understand the question. Greater audience in the sense greater physiotherapists or the patient point of view?
Hello. Sir,
yes, Kalpana, please.
Again, get an opportunity. As he mentioned very rightly, that EBP is basically something which is also concerning the patient's values. So if we are generating an evidence, it is very well relevant, not only with the physios who are practicing, academicians who are directing that practice, or the patients who are taking that treatment. So basically, it encompasses all the stakeholders, not just one. So if it is on the public portal, that would give a large access to all the stakeholders. Like the very relevant example that the able speaker gave was, we should make groups even with the practitioners who are just by our side. That is the one who's running a clinic by my side. If I am good with him, I'm sharing my data. Of course, I'm not talking about retrieving the name of the patient, but generating EBP. So that was the crux of my question. Over to you, Dr. Yeswanth.
Dr. Yeswanth.
So what I'll give you an example. Let's assume you have an XYZ patient, be it female, I'm not naming them. Let's name a number. Let's say patient number 10 had some issue. If you get to us saying that Mr. 10 condition is so and so, we have tried these and these treatments and they have worked or they haven't worked, then we'll provide you all the evidential data, what we have been following, ours and our evidence, what we have searched.
Okay.
But we are not directly, voluntarily going and sharing with any one of the physios.
Dr. Yeshwanth, just a follow-up to Dr. Kalpana's thing.
Yes.
Is there a possibility of publishing the data? As you mentioned, there's PubMed, and as you said, systemic reviews, right? So how about you also, trying to...
Yes, sir. We tried, sir. We tried in 2017-18. I have employed 2 MPT physios from the Nizams.
Okay.
I have specifically recruited them only to collect this data in a proper structured way, because my main focus is to run this show. To run the business. So because these things doesn't give us any revenue point of view, they don't make any value to us. It's only out of passion we are doing. So I have appointed 2 staff MPTs from NIMS, because NIMS have very good background of this clinical data gathering. So unfortunately, we couldn't make that because they couldn't cooperate. Managing staff is very difficult because they feel easily bored handling.
But I think among the community, just an add-on to Dr. Kalpana's question, among the community, if we come together and together we conduct a small research or a case study and then try to publish it, I think that answers Dr. Kalpana's question in a good way, because your study, the process which you have published, is actually accessible to a lot of people. And it also might be a standard, and it will also build your institution's brand if you publish.
Yes.
Yes, I also expect the same, because when we are saying the main crux of the evidence-based practice is basically informing others about what we generate. Informing the masses about what we generate, because we cannot look for revenues and avenues in every situation. Maybe even that will be a point of generating a generation of revenue in a futuristic way.
Yes. See, because even in engineering, we publish a lot of work, the research that we do. So, it adds to immense value. We call it as intellectual property. So I'm sure it will be an intellectual property for you also.
Exactly. Very well said.
Yes, Dr. Kalpana. Thanks for asking the question, and I hope it helped you in some way. Awesome. Okay.
Thank you.
Krishna Priya asked some questions.
Dr. Krishna Priya would like to know a few examples of other innovative technologies that save time. Can you please give a quick short answer to this? What can help?
Sorry, sir. Can you repeat the question?
The question from Dr. Krishna Priya is Please ask Dr. Krishna.
Thank you for very informative session. And I know Dr. Yeswanth from a very long time. He is very good at giving examples. So I just want to ask, he said you need to save time using the technology. So few examples, if he can mention, that can cut down the time and then improve the outcomes, that will be of help.
Dr. Yeswanth, any quick inputs on that, please?
Yes. So cutting the time, it can be done from the 2 point of views. One is taking the initial assessments, because one common question that most of the physios keep asking me is, how much time do you spend with your patients? I simply tell them whatever it takes. If it required only 15 minutes, I'll take my session only 15 minutes. If it required 1 hour, I'll give 1 hour to them. And I charge based on the quality of care and the amount of recovery, and the amount of recovery I can expect on that. So based on that, I charge. So apart keeping that questions aside, so Krishna Priya has asked me on how can we save time. One is from the documentation part, and second, the treatment part. If your documentation is more structured, what I do is, usually at my clinic, what are the practices I follow? I divide the documentation based on the client symptoms. So the initial documentation comprises of around 4 pages. That I give it to my junior, where she can complete this documentation and give it to me. I take up the advanced documentation part, where the chances of errors are high. That I do it on my own. So thereby, in that time, we share our work. So actually for patient, the consultation might be like around 30-40 minutes, but practically I'll be sparing only 15 minutes or 10 minutes time there. So that's how I cut down my initial assessment time. And coming to the treatment time, what we follow is every day's treatment, we document it, and we'll document the protocol, what we are about to follow. So by that, what happens next day, as soon as the patient come, we'll open our progress sheet. We'll just see what are the treatment to be done. We'll immediately go by step by step. There is nothing like as I said, I'm not treating any neuro cases. I'm talking of more of musculoskeletal cases. So by organizing things in a more structured way, and other thing what I follow is I use this cloud technology where all our documents, patient client data, we store it in a cloud. So it's accessible to different people in the organization with different restrictions based on the amount of access they have.
So innovative technology. So Dr. Krishna Priya was asking about the technologies. I think you have already,
See, I use many things, sir. Basically, for my clinic right now, I'm using Office 365, where from software point, what I use is I use OneNote for documentation. We use Word. We use Microsoft Automate Flow. It's complete automate AI thing. Then to understand and to assess this one, we use Excel.
So basically,
the basic technology what we use.
A lot of your time using technologies for documentation. Am I right in my understanding?
Yes, sir. So we spend two parts. One is the searching part where I do it. Usually I search my research because I have access to various research portals, paid portals and all. I just enter my keyword, get the search, I refine, I give it to my junior, they segregate it even further. So that's how we save it.
So the technologies are playing a role during the search of the problem, the solution to the problem, maybe background research, and also document it very clearly. Though it looks that documentation is taking additional time for treatment, but actually it is not. Because once you have the documents always available at your fingertips, you can just get them back from the cloud and refer to them and take a particular action.
Yes.
Okay. Krishna Priya, I hope that answers your question in some way.
Thank you, Dr. Yeswanth.
Thank you, Krishna Priya.
Imagination. Which type of new equipment or machine are useful for treatment than old type machine or method? I am not very clear of this. I don't know. I think this is a coded, encrypted name. Dr. Funny Imagination.
So what is the question, sir? Can you ask me again?
Funny Imagination. Is he available?
It's okay, sir. You ask me the question. I'll answer.
The question is, which type of new equipment or machine are useful for treatment than old type machine or method? Maybe it's related to your this thing. Can you please?
No, the question has many parts to it because he has mentioned which part or machine he has said. So I feel there is nothing like machine or part of the treatment. So what I feel is there is no machine that is superior to something. There is no machine that is inferior to something. So only the efficiency of delivery depends on that machine. So let's talk about the ultrasound. The typical ultrasound costs about 15,000 or even less than that. The top branded machine would cost you around say 2 lakhs or 3 lakhs. So the main difference between these two machines, what I observed is here the quality of manufacturing is low. There is high chances of repair to that machine, and probably you might not know, or the patient might also not know whether that machine is working or not, because every time you can't check your ultrasound heads. Whereas this sophisticated machine, when you do it, when you lose contact with the surface or when it is not working, you will see some light blinking there.
Awesome.
So that's how it differs. I think when you talk of machines, that's the only difference. Otherwise, if both machines are functioning, they more or less equally do pretty much same job. Pretty much. I'll not say 100% same job. So it depends on how much your client are willing to pay you. Based on that, you can invest on your equipment. If your locality is such that they don't invest heavy amounts, then you can invest on a low budget equipment.
But obviously, the safety is definitely a priority.
Yes.
So I think that has to be ensured. Sure. Great. Dr. Jitendra Munjal has a question. So can you explain that while following the EBP recommended that ultrasonic at 1 megahertz to be given for 0.8 watts per centimeter square? Sir, a machine may vary from 5,000 rupees to 5 lakh rupees. How to judge the EBP in such cases?
Can you repeat the question once again, sir? I missed the beginning part of the question.
Yeah. He's asking, can you explain that while following the EBP,
Evidence-based practice, yes.
those may be recommended that ultrasonic at 1 megahertz to be given for 0.8 watt per centimeter square. Sir, a machine may vary from 5,000 rupees to 5 lakh rupees. How to judge the EBP in such cases? So, Dr. Jitendra, I'm not sure if the question is very clear to Dr. Yeswanth. If you are...
No, I'll answer to that. I'll answer to that question, sir. No problem. So basically, he's asking when you're practicing evidence-based practice with said frequency and said surface area, if the machine is at 5,000 rupees, on the other hand, the machine is at 1 lakh. How do you validate that? I mean, is it the same when you're using the high-priced machine? On the other hand, is it the evidence supports the same when you're using the low-point machine? As long as the said frequencies are produced in that machine, as long as, let's say, if they said on 5001, they said 1 megahertz, as long as you are getting that 1 megahertz frequency, and in 5 lakh machine, as long as this 1 megahertz frequency is coming, they both function same and they both mean same in evidence-based practice.
So irrespective of
prices, as long as they are emitting the same.
So how do you say, sir, they are emitting the same? There is a characterization certificate?
Sir, practically speaking, like I have never touched ultrasound in past 7 years.
Okay. So maybe there should be, as an engineer, I can comment a bit on this. There will be a characterization certificate for every product, which says the exact specifications, of the output of that particular product. I think if the specifications are one the same, irrespective of the price, you can go ahead with that. It's an engineer's answer, but maybe it has answered.
Yeah, Jitendra.
Hello. Yeah. So you're right in this. I just wanted this only, that there should be some certification saying that yes, these are the specifications, and we authenticate them, and this is the calibration of the machine that needs to be done. I think that is the only way we can.
Certification also increases the price again. You will not get the certified machine.
No, that will increase the price. But the thing is, like, if at all, maybe for the lower price only, if at all the radiation is like as per the frequency and the intensity, then probably I think things should be fine.
Yes, Dr. Jitendra. See, as an inventor of medical devices, I can tell very confidently that the device that you buy, irrespective of the price, should definitely come with a specification document, from the manufacturer. So if you see the specification works for you, for your treatment, I think you should go with it, because it's a certified document by the manufacturer themselves. I think that answers your question.
Okay. Thank you, sir. Thank you.
Yeah, thanks a lot. There is a question from Dr. Ravi Shankar from Start Exercises. His question, Dr. Yeswanth?
Yes, I'm listening, sir. I'm listening.
His question is, as per your experience, Dr. Yeswanth, how much time on an average it will take for any physio to swiftly move from anecdotal to evidence-based practice as a habit? Means on a day-to-day basis, you should come. I think, please.
So there are two things I would like to answer, sir. So one is how much of volume they're seeing, how many volume of patients they're seeing. So basically what I advise is in a month, typically you can only convert 10% or 15% max as an evidence-based practice. For each month, you can gradually progress about 10 to 15%. On a best of the best cases, you can convert 20%. So on that basis, on an average, it takes around 6 to 8 months. On a practical basis, 6 to 8 months it takes for someone to convert, as long as they are committed.
Obviously,
it frustrates. It frustrates a lot. Initial months, it frustrates a lot when you find a lot of bottlenecks. Some article will be paid. It'll ask you to purchase and all. So it would be very difficult. So usually it takes around 6 to 8 months.
But I think it's worth, because in those 6 to 8 months, you are actually setting up a protocol for yourself. Which
yes.
Forever with your
cleaner cases comes again, it's very easy for you to handle it.
all you have to do is download the data from the cloud. As you said, there's a documentation process.
Yes,
And
yes.
follow that. So initially, which would have taken a month, now will take only 10 days for you.
Yes, yes.
I'm sensing from your answer.
Yeah.
Okay. Narla Srikar, can we have a Q&A call? I think we are done with Dr. Narla. I hope she asked the question. Next is Dr. Vivek. Is that we use data for private clinic in research or writing papers or publication? Dr. Vivek, can you please explain your question?
No, I think he is asking. Yeah.
Sir, I want to know that can we use data by private clinic in research or writing papers or publication? That we see many patients in our clinics and record the data as well as. So can we use these data in our research and publication?
Sir,
Yes,
sir, as long as the data is collected with the accepted format, and if it is the very old data, and because most of the cases, what majority of the new researchers do is they cook the data. We call it as table cooking. They cook the data over the table. So in that case, you can only release the observational study. But still the validity of that data in research pyramid, it will be little lower.
Okay, sir.
Vivek, just I want to add to Dr. Yeswanth. See, for any device or for any drugs, the trials, we call it as clinical trials or clinical studies, have to be done. And these trials include subjects. Like in your case, you may be having a lot of patients visiting your private clinic, right? So when you have such patients coming to you, you need to have the patient consent, the approval from the patient that you are collecting data from his thing. That is one thing, a signed consent. Second thing is, once you have that, you have the right to collect data from him. And then you should have once you have such data, you have to go through a ethical committee's review. And we call it an EC, ethical committee, who will review the protocol of the study that you did, who will also see what data you collected, and then anonymously, without revealing the important, the private details of the patient, with ethics committee approval, you have the right to publish the result. And that is how the research is getting published. So if you read any paper, you will see that that paper has been published post ethics committee approval only. So once you have this, I think you can. So that's
sir, excuse me, sir. It was the procedure of an institution, no?
I'm sorry. Please come again.
You are saying that the procedure you are saying is institutional data. I am asking about private clinic. Okay.
Even if you are a private clinic, you need to take consent from the patients. Because being me as a private practitioner, I always take consent from the patient. If the consent is not signed, I'll write on the consent form as consent rejected.
Yes.
Okay. So when I'm rejecting the consent rejected, it's patient wish to reject the treatment and go. If they want to continue, I'll tell them I'll not bear any risks. I'll not give them an ID. So if I'm not giving them a patient ID, what happens is the moment they want, I will not give them bill. I'll not give them this thing, the patient right. So it risks to them as well equally. So usually they oblige to the consent form usually.
Yes. Great. Thanks.
But if you want to conduct an advanced study prior to this, you need to take the ethics committee approval.
Yes.
What are the things, and you need to assure the patient safety and patient this thing.
Yes.
And then the ethics committee will give you clearance, and then you need to collect the data. Prescribed.
Thank you. Thank you very much.
Hello.
Yeah. Who is this, please?
Sir, this is Jitendra.
Dr. Jitendra, please.
Just to add on, as sir was saying, if the consent is denied, so I will not give the registration number and will not give the treatment. So actually, there are consent for two different things. One is for research, one is for treatment. Ethically, he cannot deny the treatment in case he's not willing to go in for the research thing.
Sir, I want to add to it. I think there was some confusion from my end. We have the consent. I think I don't have it right now with me. we don't deny the treatment to anyone just because they denied their consent. We have that consent in order we advise them that there are certain risks involved. Let's say I'm manipulating, let's say I'm doing some needling. So the side effects or the adverse effects of sometimes needling is also explained in that. We, for each and every patient, we don't take the research consent, we take the treatment consent, in which we mention the line that as we can use this information for our observational studies or whatever study, we'll mention that.
But
Sometimes in
again,
India,
don't you think
patient get scared when you ask them for simple like let's say patient came of simple neck pain. When we ask them to sign something, they have this perception in India that when you ask them to sign, they not all fraction of them, they believe that you are going to damage them or something serious, only you are asking them to sign. In
So
such
it's good to
cases,
have
what we do is we'll tell them what are the advantages in signing this and what are the disadvantages in not signing this, but we'll never refuse the treatment.
Great.
But sir, isn't it wrong again that you have just one line in the end that saying that we
Sir,
can use
our consent form is of
the
3
data
pages.
for
Our consent form is of 3 pages. I just briefly said it. I didn't read out my entire consent.
Consent form is
We
usually a
have
small
separate
document.
consent for
Okay,
teleconsultation.
thank you.
We have separate consent for the clinic. We have separate consent for. We have various formats of consents.
Because the question arose
And it
because
was
you
so
said that
well prepared.
the question arose because
Yes.
you said we will not give the bill, we will not give the registration number. That is why the doubt came to my mind.
Yes. See, I'll give you one thing. I'll give you one example. Let's say you are my patient, and I treated you for dry needling, and in that I'll tell you, see, sir, there is mild chances of swelling or some sorts of pain or something. Let's assume you didn't sign it. Because in our consent there is a provision to withdrawal of consent also. At any given time, patient can always withdraw his consent. And if you are not signing, and if I'm giving you all my privileges, and tomorrow if you come and tell me you didn't tell me this before, and now you are telling me after this about the consent, so how will I answer you?
It's always
Not
good
saying
to have
most of them will do that, but yes, there are fraction of people where I had similar experience, where they'll say, you didn't tell me this, otherwise I wouldn't have gone through this. You didn't give me enough counseling on this. They'll give you this sort of comments.
Great.
Yes, sir.
Sure. So,
Sounds good.
Dr. Jitendra,
Thank you.
yeah. Dr. Jitendra, I think Dr. Yeswanth has answered that. Always good. I think what Dr. Yeswanth was trying to explain was it's always good to have some documentation in place for every patient based on his condition, and then go ahead with treatment rather than not rejecting anybody on any ground. Great, Dr. Yeswanth, that's good. Dr. Nalla, I have another question to ask. May I, with due respect? Dr. Nalla, do you have a question?
Do actually regarding the research, which I could not
Please go ahead.
text. So yeah.
Please go ahead, Nalla.
What are the resources? See, as I told, I'm freelancing. I did face few problems while doing the research. So I collaborated with few of the freelancing engineers or anybody of their respective field, and we've been developing softwares and exogaming and all. So when we have reached a good hospital, a good corporate hospital, we have reached since we had a good copyright stuff and all. But, to extract the data, we could not get the data, but they made good money. It was the same thing with the government sectors too. We have approached a few government sectors in which they indirectly asked us on the face how much are we giving them the share. So yeah, how do you really deal with it? Like, yeah, I have two things in my hand which I'm not able to, take it forward here. We're not getting good opportunities or anything like that. Where we do the trials or case studies or anything. So how do you do it?
Dr. Yeswanth?
Can you frame that question for me, sir?
So her question is basically she's having some problems while doing a study, especially from the data gathering front. Okay, and she might have got some data, but at the end of the day, what is happening is the parties with which Dr. Nalla associated have actually made some money, but Dr. Nalla did not get her outcome. Am I right, Dr. Nalla?
Yeah, absolutely.
Yeah, very good. Thanks. So her problem is basically: are there any ways to tackle these situations, or or is there a standard protocol to get into a hospital to a clinical study? Do you have anything in your experience, Dr. Yeswanth?
Yes, in that regards, I think mostly NIMS will help us a lot on that front.
I don't
Because you have an ethics committee at NIMS, and in Usmania also you have few good people. I think I know one with name. Maybe I'll share their name personally.
Yeah.
So what you can do is you can first approach the ethics committee. You can give them a brief synopsis on what you want to research and how many samples are you going to test and what are the assurances that patient safety. You need to submit such documentation and get an approval. Then you need to approve on what basis you are collecting the data and how are you going to get analyzed. You need a statistician to again get the outcome of the graphs. Then it will be streamlined. Otherwise, don't collect the data and go to any private person. They will exploit you, obviously.
No, yeah, I'm experienced right now, but yeah, that
Dr.
is.
Nalla, I just want to add one more thing to Dr. Yeshwanth's inputs. The thing is, if you go to the institution, please ensure one thing, that institution has a ethics committee on board.
Actually, I did. They do have it very well, but I mean,
Oh, then also you faced. Okay.
then also I face.
Okay, then there is some serious problem with the way things have proceeded. But usually, even in even with the experience that I have, there's always a committee on board, and once that committee approves it, because it approves only when it ensures that all the processes are in place, all the human resources are in place, all the technologies to acquire the data is in place. Then I don't see a reason why you will not get access to data. So maybe something went wrong in your case, but the minimal input that I can give from my end is please ensure there's a good ethics approval. And one more thing, the ethics committee should also be registered by the under the ICMR guidelines.
ICMR, yeah, it is actually.
Okay.
But still,
and it's something which I think
bad
we
people.
can discuss offline again, huh? Fine. Great. There are central bodies for, very well said. Vivek sir, Dr. Vivek has served in process of research. Who plays role of ethical committee in a private clinic?
As I said, you need to search for the ethical bodies, that institutions that are near you in your respective cities. Usually we prefer going to the government bodies only, because wherever I have personal contacts on that extent, or the HODs or the department staff, I approach them. Through them, I go and approach the ethics committee.
Very nice, very nice. And I think to answer to Dr. Vivek's this thing, small add on that. I think his question was one is ethics committee play role in ethics committee. Second thing, Dr. Vivek, if you are doing the if you are conducting the research, you can be a coordinator or you can be the principal investigator. Okay, so your role will be the principal investigator, and the ethics committee will be from the government body, as Dr. Yeshwanth told. I hope that answers your question, Dr. Vivek.
Yeah, I got my answer. So thank you very much.
Thanks a lot. I think with this, we are good to go. Dr. Yeshwanth, I request all the audience to mute their microphones, please. Dr. Yeshwanth?
Yes, please, sir.
Yes, so I think it was a great session. And it was one of the sessions, I think one of the longest sessions we had, with lots of queries from the audience, very well answered with whatever knowledge we have, whatever experience we have. I thank the audience for being patient, listening to the answers, and I'm sure it added some value. The takeaways can be, we can have a small group among ourselves if anybody is interested in, where we can share our knowledge, our experience, our case studies, because every small step that we take has a big impact in physiotherapy and rehabilitation is what we believe in. I think this platform is all about that, and understanding what are the things that are happening in our country, And with the experts that Startoon Labs brings on board, who have practiced abroad, I think it gives immense exposure to what is happening in the adjacent countries and how we can upgrade ourselves to ensure that even our practices become world class. I think that's where physiotherapy and rehab is now heading, and we are quite hopeful that it will reach great heights in the coming days, and it will become the same with good standards as being practiced in countries like Australia and others. Thanks a lot, Dr. Yeswanth, on behalf of myself, my team, and all the audience. And I request all the audience to give any feedback that you would love to give us, basically with respect to how it was today's session. And secondly, more importantly, if you are looking for any other expert to come on board and talk about the expert practices that are happening, or maybe some topic that you want we as a company to cover, to bring on an expert and have a forum like this, I think we'll be more than happy to do that. So please, if you have any topic that you want to